Irritable Bowel Syndrome Awareness Month takes place each year during the month of April. The International Foundation for Functional Gastrointestinal Disorders defines IBS as a chronic digestive condition characterized by recurring abdominal pain or discomfort. The IFFGD focuses its efforts on IBS diagnosis, treatment, and quality of life issues. The specialists at Advanced Gastroenterology and Surgery Associates explain how they diagnose and treat IBS.
Irritable bowel syndrome is a chronic condition. The most common reason that we actually see a lot of patients, maybe outside of acid reflux. One good thing about irritable bowel syndrome that I tell patients is that it won't kill you. You may feel as though you're dying, but you're not. And it's actually, in the past we called it a diagnosis of exclusion. However, now there are sort of definitive parameters. You can actually make a diagnosis just based on the patient's symptoms. If someone has chronic abdominal pain associated with changes in bowel habits, and it's been going on at least 3 times for the past 6 months to a year, then you can, by what's called the Rome criteria, diagnose them with irritable bowel syndrome. Of course, these are patients without warning signs, meaning no weight loss, no poor appetite, no blood in the stool. And it can be divided into diarrhea predominant, meaning that the patients mainly have diarrheal symptoms, or they can be constipation predominant, where patients have mainly constipation, or you can have both. But it has to be abdominal pain associated with changes in bowel movements. If everything else is there are no other warning signs, then you can make the diagnosis of irritable bowel syndrome. There are many various things that potentially could cause it. Stress. Patients usually have more stressful situations when they get their symptoms. Since the advent of the probiotics, they have helped a lot in controlling a lot of symptoms, especially in someone who we think there was a triggering factor from a virus or antibiotics. We know that the colonic bacteria is very important. So replenishing the good bacteria in the colon is crucial.
Studies estimate that IBS affects around 15% of the adult population. However, only 5 to 7% of adults have been diagnosed. IBS affects about twice as many women as men and is most often found in people younger than 45. We've included links to more information on irritable bowel syndrome, as well as contact information for Advanced Gastroenterology and Surgery Associates under the IBS Awareness Month story link icon on our homepage, yourhometownhealth.com.